Well, good morning, everyone. Happy Friday. I've got a couple more people joining. We're going to let some people connect to audio and get logged in, and then we're going to get started. But happy Friday, last Friday of July. Year is rolling by. Okay. Alrighty, well, we have a very exciting interview this morning coming up with Rod Jenkins. He is the health director for Durham County. Just a couple quick announcements before we begin. As always, please make sure to write your name and organization in the comment box and post any questions that you have along the way during the interview. Also, as a reminder, please make sure to mark your calendars. Our next monthly coalition meeting is scheduled for Friday, August 19th from 11 a.m. to 1 p.m. And last but not least, earlier this week, we shared a press release document related to the progress report that you can tailor to share with your specific organization and your colleagues. So please consider utilizing it to share the results of your dedication to the coalition and to highlight the great work that has been accomplished because of your efforts. So a big thank you again to Steve Hahn for taking the time to create that press release. Also, thank you to Shane. He has made several social media posts about the progress report. You can find those on LinkedIn, Twitter, and Facebook. So please check those out and share them. And with that, I think I'm done. I'll pass things over to Heather. Excited to get started this morning.
Thank you, and welcome to Coalition members. I am so excited to have this conversation with Rod Jenkins, the Health Director for the Durham County Department of Public Health. So Rod and I just want to say a quick comment. Our connection story is a reminder to all coalition members to invite your new friends onto Friday Facts. Rod and I met at the UNC School of Public Health just a few months ago, and we immediately hit it off. And I knew I wanted to meet Rod. So within a few days, he was scheduled onto Friday Facts. And so rather than being normal people and have a nice one-on-one conversation in private, I was like, it'd be more fun. Come on to Friday Facts and let's have a talk with the audience so they can learn more about you and the important work you're doing. So Rod, welcome.
Thank you for having me, Heather. I only can wish to match your energy and your enthusiasm.
Well, I know this morning a little crazy, but all right. So tell everyone, because I know you have what you're doing right now is fascinating, but I want to go back a little bit. Tell everyone a little bit about your background. What were the experiences that you had that shaped you and brought you to where you are today?
It's never easy talking about yourself, but I'll do my best. I'm a Charleston, South Carolina native, born and bred. And, again, come from a family that is committed to service to humanity, be it in the church, be it in the medical field, be it in the finance industry, matriculated in the public schools of Charleston County. And had the great fortune, Heather, of receiving a full ride to the Citadel, which is the military college of South Carolina. Spent 4 years institutionalized and did a little bit of military service, was happy to break free and went to work for the old school Wachovia Bank before they were First Union, Wells Fargo, or Walk All Over You, whatever they call them. And definitely wanted to really learn more about finance, how money works, really cut my teeth and, really all facets of money, because let's just face it, that's what makes the world go round. And did that for about 12 years and really decided that, it's only going to be a few regional players that are making major moves in the banking industry. It's time for me to do something else. Had the great fortune of meeting my wife, and in the midst of courting, I happened to say, yeah, I want to get this master's degree and I have some plans and I'm just Mac Daddy smooth and she's calling my bluff at every corner. Went to the Arnold School of Public Health at the University of South Carolina for a master's in health administration, and that provided the gateway into healthcare. And we moved from South Carolina to North Carolina, and it's been the best move we've ever made. Heather, she's a licensed clinical social worker by trade, and she was able to come to North Carolina and get into oncology social work. and I was able to kind of make my way into county government. And it has been a crazy experience thus far. Worked for a local hospital, then had the great privilege of being the assistant county manager in Robeson County down in southeastern North Carolina off of I-95. And then made my way to Fayetteville when I got into public health, which is what I really wanted to do as the deputy public health director. Did that for about 11 years and got the promotion to be here in Durham, and the rest is, well, as they say, history.
Well, it's an amazing transition. I mean, to go from your military work, which thank you, and your military training, to banking, to public health. I mean, is there a theme that goes through there, or what lessons from the military what lessons from banking brought you into public health?
I would just say, again, it's still the undercurrent is always service to humanity, being a good public servant, be it full battle rattle on the field of battle, or just really suit and tie, conservative, navy blue, really behind the desk, helping people to achieve their dreams in banking, and really educating as far as the various nuances with money, because you'd be surprised, people think they know money, but they know how to count money. They don't know how the money works. And then really going into public service, truly the joy of my life. I can't see myself doing anything else. Really being able to help the citizens of different locations, be it Cumberland, Robeson, Fayetteville, Durham. I think the underlying theme is always going to be service to humanity, really trying to do our best to make this world a better place.
Wow, that's an amazing theme going through that. And you're right, I hadn't actually knew that with military and public health. I hadn't thought about banking's role in that as well. So I'm going to think about that for a while. But all right, you and I talked beforehand, and we talked about what's going to come out, and we said we're probably going to talk something about COVID. So let's sort of get into it. When I think about this pandemic, and people use the term and military, that we talk about the front lines. And when I think about the front lines, there's been a number of them, but being the director of a public health department seems like one of those intense front lines. What has that been like? And it was a brand new role for you. If I do my dates right, you had just started in Durham. So tell us about the challenges, and what is it like having a new job during a pandemic, a global pandemic in Durham? So
one of these days, Heather, I'm going to sit down over the course of a couple of weekends and just write it all down, because many people tell me that I need to.
Yes.
There's a couple more wrinkles. Of course, I'm happy to articulate those finer facts. Number one, you're absolutely correct. I started January 2020, and I'll never forget. My family was still in southeastern North Carolina in Lumberton, and we were making a transition up to the Triangle. So I had a little bit of free time on my hands, and we have nice facilities at the Health and Human Services building. So I was downstairs, only one in the fitness center, treadmills going, TVs all over the place, and it's just me. And I'm getting my exercise on like a true public health director should. And every single monitor had COVID, saying it's coming, it's coming. So like those scary movies had that dun 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 dun. I was like, holy moly, my life is about to change. And that it did. We began to get a lot more reports from the Federal Health and Human Services, CDC, State Health Department, and it was just off to the races. And meanwhile, I barely know where the restroom is in the building. So for the most part, it was really trial by fire. But Durham is such a special place. The community connections, the collaborations, the partnerships. Although I was a new public health director, we had established so many lasting relationships to where I could call on Duke and say, hey, we are trying our best to get our surveillance apparatus up and running so we can know where the pockets of infections are. Can you help us? In comes the MBA students, in comes the nursing students to come into our operation and work with us. And then we say, hey, we need to set up a site in a hard hit area to where we could call a positive case automatically know who the close contacts are, and then just automatically schedule an appointment for them. Boom, that's set up at Holton Recreation Site. We call the mayor, we call the chair of the county commissioners. Done, done, done. So we were able to really have cutting edge initiatives to help out. You speak of the front lines, it's not about Rod Jenkins, it's all about this fantastic staff that I have. From my emergency management partners, to my nurses, to my emergency preparedness coordinator, to all of my deputies. We all play a valuable role. And it goes without saying, Heather, the sacrifices that were made were immense. I mean, we literally went 18 months straight, no holidays, barely had weekends. I mean, we were just committed to this response. And the toll it is taken is just, unimaginable. I really shudder when I think about the mental toll it's really take on staff and everybody involved when we really sit down and take a full accounting of our activities. But I couldn't be more proud. We continue to do the best that we can. COVID is not over. I wouldn't be a public health director if I didn't say it. We have the BA.5 subvariant of the Omicron variant that is highly transmissible. So although public health, Heather, is out of the mandating thou shalt, we are now back into our original posture, which is advising. And we certainly advise people to get tested, get your booster, get your vaccines. It's out here, it's free, it's widely available. And, although we're not telling you, you shall wear your mask, but just continue to consider wearing your mask indoors. And if you don't feel well, stay at home and take advantage of these at-home tests as well, because they are the surefire way to find out what your status is.
So, I mean, thank you so much. First of all, thank you. Thank you for everything that you've done. And I love the way that different groups you were able to, and you and your team were able to bring them all together and bring this coordinated Durham, response back in terms of different departments. In terms of what you received from the public, there's been a lot of talk about the trust and the mistrust of science, of government, of public health. How was that experienced, and how did your military training help with that in terms of what you received or not? But how was it received in Durham?
I would say we were blessed, and I don't use that word loosely. We're blessed in Durham. When I think about the number of public health directors, not just statewide, but nationwide, that have been harassed, that have been spat on, that have been cussed out, stalked. And when I think about my experience in Durham, it's completely different. When I came in, former Mayor Steve Schewel, former Chair of County Commissioners, who's currently Vice Chair Wendy Jacobs, were committed to the science. They believed in what was going on. They didn't say this is a hoax, we don't believe it, because I let them know, as public health director, one of the grim responsibilities I have is to have my signature on every death certificate for someone who dies in Durham. And I tell them, seriously, people are dying because of COVID. So I had the support. They thought it not robbery to form a blue ribbon task force to really think about the recovery and the renewal of Durham. What's it going to look like when we come out of this? How can we get businesses involved? So we had every sector of Durham represented, from community colleges to universities to hospitals to the business sector to small businesses. I mean, everybody kind of pitched in. So Durham is so unique. We're so cutting edge, so forward thinking. And that has helped us out tremendously, to the point where, we're just in such a prime position. And I might add, as a huge plug to our county commissioners and city council.
Plug away.
Don't think for a second that they weren't paying close attention, because I had to give them briefings and let them know, because we didn't miss a beat from business and industry and recruiting. During the entire pandemic, they still brought in billions of dollars in industry and businesses that want to make Durham their home. And as I tell my staff all the time, we always have to stay on point, because the one thing that someone who's coming into a new community wants to know, they want to know about the health and vitality of that community.
Absolutely.
Businesses want to know about it as well.
Absolutely. Oh, okay. Well, and the questions and comments are starting to come in, but that you do have an amazing situation there. So we are getting we're getting some shout outs to the Durham Public Health from Shane. And yes, I'm in Orange County, so I do a lot. I think that the health department's been amazing for testing here, and Durham has been wonderful. But Mary Bethel asked a question, and others are welcome to ask a question. So speaking of monkeypox, we're moving from COVID to monkeypox. What is your health department's plan at this point for moving forward to address monkeypox?
Thank you so much for that question, Ms. Mary. We appreciate it. Of course, everyone's hearing about it. It is the tempo and the aggressive posture of the public health apparatus is getting a little bit more intense and stronger around monkeypox, and rightfully so. The one thing that we are trying our best to do straight out the gate, Ms. Mary and others, is destigmatize monkeypox. We want everyone in the viewing audience to know that this is not targeted at one specific segment of our population. Anyone could get monkeypox, anyone. And it's not right to really try to tear down members of a specific demographic. With that being said, we thought it not robbery here at Durham to be one of the first 7 counties to request monkeypox vaccine. And we have had that vaccine for the past month or so, with more to come. We know that we have a pretty robust population, LGBTQ community. We embrace them. They are our partners. They are our members, vital members of our society, and we love them. And we want to make sure that they're safe. So as a result, we have been providing tons and tons of vaccine. We have encouraged primary care providers, urgent care centers to test for monkeypox, because I will say, although we vaccinate in large numbers, we don't necessarily have the manpower to test. That's sort of a primary care function. And delighted to say that all Duke urgent care centers, lots of other urgent care centers, and most primary care physicians in the Durham area are able to test. Vaccinations are our thing. We have been distributing vaccine to Duke, to Duke, UNC Health, UNC Hospitals, and Orange County Health Department, and other areas in our contiguous area. We want to make sure that the community understands that monkeypox is serious. As it stands right now, we only have 2 confirmed cases, but we know that it may be more out there. The criteria has expanded, primarily because we want to make sure that we address all avenues, but it is getting serious. And through messaging platforms such as this, making sure that we connect with our community partners and our trusted advisors, we are getting the word out about monkeypox. One thing that I pride myself on, and under the leadership of Dr. Alicia Smith, who's our public health public information officer. She does a fantastic job. To be quite honest with you, I don't know when she sleeps, but she gets the word out through social media, through traditional print messaging, and our response has been intense thus far.
Well, so I'm scared to ask this next question, because we've gone from COVID to monkeypox. Like, what I was gonna say, what's next in terms of what's the next pandemic? But what's next in terms of then the key initiatives? Is it all COVID and monkeypox, or when you look over the next year ahead, what are the key initiatives for the department, for public health in general? What are we doing now?
I will say, we are on the ready and in a really preparedness posture when it comes to all of these viruses and variants. It's unfortunate, but this is what public health does. And of course, I know, members of the listening audience who are familiar with public health, you all know that we're silent professionals, by trade. We kind of sit in the back, we do our job, and we're not necessarily ones to be thrusted into the forefront. But rest assured, we are maintaining that same preparedness and readiness posture. In the meantime, we are working on other things to include chronic care initiatives, minority diabetes prevention programs. We're doing tons and tons of maternal health programs. We're working with our Black doulas. Black maternal health and maternal health in general is a big initiative from the county commissioners. One of their main focuses for this fiscal year. And more importantly, we're collaborating like you wouldn't believe. Our award-winning partnership for a healthy Durham. If you're not a member, I encourage you to join. That is a fantastic group of community stakeholders who keep yours truly accountable. They keep me on the edge of my seat because they want to make sure that Durham is a healthy and vibrant place. I'd be remiss, Heather, if I did not say we are fiercely committed to racial equity and health equity. That is our thing. And I know that's your thing as well. So I am so proud of this organization and all that you do. And, I look forward to future collaborations.
Well, I'm so glad you just said collaborations. I feel like the theme of this is both service that you highlighted and collaboration. So moving to collaborations, here we are with the North Carolina Serious Illness Coalition. What are some of the ways we can collaborate? We are a statewide organization. We represent and we have partners. We're very close actually with South Carolina, your educational and your home. So what are some ways that we can connect and work together?
As mentioned, again, the Partnership for the Healthy Durham is a fantastic way for this organization to be infused. They have a number of different work groups that align with the tenets and the mission of this organization. And of course, as I mentioned, we do have chronic care initiatives and diabetes programs. But, again, let's not deceive ourselves. COVID is an illness in which people are hurting. There is such a thing as long COVID, and people are really, really in dire straits when it comes to it. So we want to ensure that folks understand that there are organizations such as yours that are here to help, to advocate. Again, I love the things that you all have lined up, in as much as all the things you want to do as far as increasing awareness, advanced care planning, and addressing the needs of individuals with serious illnesses and caring for them. That's what we're here for. That's our mission with public health. Although we do it quietly, we want to bring attention. And again, the one thing that you all could do that would really help us is advocating for funding. We know that lots of attention and lots of funding have come this way, unprecedented amounts because of COVID. But we don't want it to be a situation, ladies and gentlemen, to where COVID finally dissipates and the money goes with it. We want to really continue to fund public health because there's always going to be needs.
Okay, well, that's great. And that we are a group of advocates, and I see my wonderful colleague, Mary Bethel, who teaches me everything about policy and advocacy, which actually is a good segue into I think one of our last questions we'll have time for, but we are putting together our legislative agenda and what are the things that we advocate for. And so we can, and funding, as we know, it's like on so many different initiatives. So, but let's continue to work together and find ways to partner. So I have a question for you, and then I also invite if folks out there have a question, they can type it in. So I want to link back your comment about there's been so many things you've been involved with that you need to write about. And I'm going to share, you and I both have gone through the same academic program, and soon you're going to become Dr. Jenkins. In the process, you are finishing up the UNC Gilling School of Global Public Health Executive Doctoral Program in Health Leadership. Know you have a doctoral dissertation to do soon. Can you give us a little hint on maybe what are some of the topic areas and ways that maybe we can help you as a coalition? And let me just tell you, anything you need to write about to get out, even therapeutically, do it as one of your assignments, do it as your dissertation. But if you wouldn't mind sharing what you're going to dive in, and we've got a whole group of academics and researchers in our group. So how can we help you?
Absolutely. And thank you for bringing that up. And as Heather knows, as I have professed to her after meeting her the first time, that she is my hero when it comes to schoolwork. I have selfishly picked up her 3 things that she wants to accomplish as a student. Number 1 being most important, I want to stay married. Number two, I want to do as minimal work, quality work as possible. And number three, I want to finish on time. So I will say I would love for this group to partner with me if they can. I'm a health director, and one thing that I've noticed that there is a dearth of diversity when it comes to public health leadership. So I have really done my best to really understand why there's not too many people that look like me in the ranks of public health leadership, when in fact you go into any public health department and you're going to see a lot of people coming to services that look like me. So why is it that we are not attracting that talent? You know, again, my background is in the military, it's in finance and everything. So again, it's not that it cannot be done. So that is certainly a topic of interest. And I look forward to being able to do key informant interviews and surveys, all these terms that probably make Heather shudder, but nevertheless.
I'm done, so I'm fine with it now. I'm like, key informant away. Are you gonna do qualitative, quantitative, what kind of analysis?
Oh my goodness gracious. I am fully immersed in everything you just mentioned, but it's certainly going to be qualitative, and we are looking forward to this long journey that we have ahead of us, but I'd love your help. And, you know, again, I am certainly going to take Heather up on her offer, because there are many times when we're down in the dumps and life is beating us across the head and we need a pep talk, but we appreciate it.
You will do great. And there's a number of folks in the coalition that can help, especially with on a variety of things, whether it's qualitative work, but also really how to get the word out about something really important. I know we only have a few minutes left, but I already have some brainstorming for you about other initiatives. And I just heard last week on the news that the School of Public Health, the applications have like doubled. So there is, you know, we do need to find the positive out of COVID. The positive out of Monkeypox is it's really put public health on the front page, and there's a lot in our younger generation that's now interested. So how do we make sure that all voices are heard and go into the field? And so that is something we will spend a lot of time with. We do have, we'll end with Mary's question. With all the challenges of the last few years, what do you see as the biggest challenge of public health in the next few years?
Re-imaging ourselves in preparing for the future, Mary. That's certainly our biggest challenge, because life is not the same for us in public health. The same way that life was upended for, you know, every single one of us because of COVID. So now we have to really determine how we're going to move forward as a public health workforce, using platforms like this, and employees really wanting more telecommute options, and being able to practice telemedicine and working in virtual spaces. You know, it's been proven that it can work. So going back to the traditional ways of public health may not be an option. Going back to the traditional ways of work may not be an option. So I think that's been the challenge. I'm so grateful that the North Carolina Institute of Medicine has that task force on the future of public health. I was fortunate to be a part of that. And there's some serious findings that are going out to help us along the way. But again, Ms. Mary, we appreciate that thought-provoking question.
Well, Rod, can't thank you enough for being here with us on Friday Facts, but for all the work that you do really on the front lines of public health. And I cannot think of a better leader for Durham County. And I know you talk about collaboration, so I know you want to put the love out there for the team and all of your collaborators there in Durham. But really, it sounds like you are an inspiring, I don't know, good military. You're the inspiring leader that's helping move forward. And it is to be able to go through this and still have a smile on your face as you face other challenges. But we are here for you. We look forward to finding more ways we can partner over time. And I'll make sure all your papers are done on time. Get it done and have fun. And thank you. Thank you. And thank you to the coalition members for participating.
Absolutely. Thank you all so much for having me. This has been great.